Fresh off major wins in last year's healthcare debate, the American Optometric Association's doctors and students came to Washington by the hundreds, determined to solidify their recent legislative successes.
Thank you very much for all your assistance these years too. Thank you.
You all come on out.
And wrap up unfinished business.
This year has been the biggest year for patient access victories.
I can't tell you how proud I am of this organization and the tremendous job that you do. And that comes from the grassroots all the way up. I can't tell you how proud I am to be one of you.
I've often asked where they got that number.
One of AOA's biggest victories in 2010 was authored by Senator Tom Harkin, who the group honored. The Harkin Patient Access Amendment was designed to end decades of discrimination by requiring insurers to recognize the full range of medical eye care services that optometrists provide.
The first ever federal level non-discrimination clause to protect optometrists regarding their participation in health plans. I was more than happy to do that. I'm proud that we kept it in, and again, I thank you for your recognition earlier when Abby mentioned that. So to me, optometric care is an integral part of the health care system of America, and is also, as I like to think, is a part of prevention and wellness and keeping people in better health.
Other notable AOA-backed provisions include the official designation of vision care for children as an essential health benefit and the safeguarding of hard-won state patient access laws. The AOA's stepped-up advocacy and its growing list of federal legislative and regulatory accomplishments is being noticed in the nation's capital.
It's incredibly important and incredibly helpful to have an active AOA here in Washington and at home in Vermont. And when I hear from folks back home, especially when I hear in advance of something coming up for a vote, it means I can go to work on behalf of AOA and get something done, get something modified, so that at the end of the day, we're doing better for the patients, better for the taxpayer, and better for the AOA.
I've learned that optometry really is a legislative profession, and as much as we like to make the decisions, it's going to be our elected officials who decide what we can do for our patients and how we can treat them, and then of course how we get paid for it.
Turnout this year was one of the best ever. In fact, a record number of students, more than 150, made the trek to Washington. Grooming the next generation of advocates is one of the new president's top goals.
I'm doing 20 stops in 20 months. I'm going to all the schools and colleges of optometry, and I'm bringing the message of being part of AOA, being part of the family of optometry.
The students and practicing optometrists took their message directly into the offices of every senator and House member. The AOA also hosted members of Congress at a working reception on Capitol Hill.
When I started running my first time, optometry students were involved in my campaigns. And so I got to know that we have a great School of Optometry at Northeastern State University, got to know those students and got to hear their issues, got to actually go to some of the facilities where optometrists are in our district, and it's been very easy to support the optometrists.
My optometrist.
They were briefed by the nation's top small business advocate.
The 1099s. The minute I saw that, I said, no, small businesses are going to have too much paperwork with this. Cannot afford to have these 1099s, and we called for the repeal.
They honored a newly elected ally.
From the Illinois 17th, I want to thank each and every one of you for what you do for the people of the United States and helping them be able to see better.
And heard bipartisan support for legislation aimed at further expanding patient access to essential eye and vision care.
H.R. 1219 is so important. It will give patients more access and more choices. I introduced that bill because I believe that optometrists deserve to be recognized as physicians under Medicaid. As I said, the right thing to do for the profession and the right thing to do for children, adults, and older Americans.
The student loan repayment program helps bring together educated healthcare providers with rural and urban community health centers that need their services. When the program was restructured in 2002, optometrists, unfortunately, were left out of the program, so we're going to work to correct that.
The reach of the conference extended from one end of Pennsylvania Avenue to the other. Shortly after the AOA board concluded a series of meetings with congressional leaders in the Capitol, Dr. Ellis led a delegation over to the White House to press for optometry's priorities.
Please reach out and thank these
But the
Congressmen,
AOA's message to its members is clear. Advocacy for optometry's future involves far more than 2 days of meetings in Washington's corridors of power. Optometrists advocating for their profession, their practices, and their patients is a year-round job that takes place in communities across America.
Success in advocacy is all about relationships. Those relationships need to be nurtured all year long. And so, yes, it's very important that our members are here meeting with them in Washington. It's important they meet with them back home in the home state. It's also important that the staff and volunteers maintain that relationship throughout the year.
AOA members who came were treated to Washington in full bloom. Members of Congress having valuable conversations with constituents. Dedicated doctors carrying important messages about patient access and quality care fresh from home. In Washington, this is Nancy Mathis reporting.